Hi, I'm Peggy Bailey, Vice President for Housing Policy at the Center on Budget and Policy Priorities. One of our recent projects has been helping to advance the framework for an equitable COVID-19 homelessness response, an incredible new online resource. This was created by a new partnership of national organizations and experts who are working to help communities navigate their COVID-19 homelessness response in ways that will improve homeless support services, not only now, but in the future. Today, I'm joined with Indianapolis Mayor Joe Hogsett. We're going to explore how Indianapolis is prioritizing CARES Act funding to address homelessness during the COVID-19 pandemic. Welcome, Mayor Hogsett.
Well, thank you, Peggy. It's an honor to be with you and be given the opportunity to discuss so many different and important issues that impose on all of us, whether it be here in the city of Indianapolis or throughout the country during this global pandemic. You are right. The city of Indianapolis has been working diligently to protect our homeless neighbors from COVID-related challenges, and while continuing to implement our community plan to end homelessness.
Great. Well, why don't we start there and how COVID-19 in particular has impacted your response and impacted people experiencing homelessness in Indianapolis. Can you provide a little context around that?
Yeah, certainly. Look, COVID-19 presents a variety of challenges, obviously, when it comes to a lot of different issues, but homelessness among the top of those issues. Many service providers, frankly, had to reduce their face-to-face services. I know one of our most significant providers here in the city of Indianapolis actually had several of its employees become infected by the virus. And as a result, they closed their doors, which has ramifications that are self-evident. And that was just one example of a service provider who ultimately had to close entirely for a brief period of time. Each had their own challenges as it relates to staffing shortages. Each had their own challenges as it relates to PPE and disease management. So all of this virtually eliminated the indoor spaces for individuals to go, particularly during the day. And it greatly reduced the number of places that people could be sheltered or could go to sleep during the nighttime. So they really became vulnerable 24/7 during the day, and then, of course, throughout the evening if they did not have shelter.
Right, right. So how did you address these concerns?
Well, first and foremost, the city of Indianapolis enjoys a very close and effective working partnership with the Marion County Public Health Department, along with Wheeler Mission and others. And that partnership seeks to address the needs of people who are both sheltered and unsheltered. We set 15 hand washing stations and 16 portable toilets at locations throughout our downtown area. We partnered with local suppliers to set up safe and dependable daily food delivery so that our neighbors would not go without adequate nutrition and food. We also established temporary overflow service and shelter space. That allowed for those neighbors who happen to be homeless to seek shelter while maintaining a safe distance, which was, again, part of the challenge. And I know we're not alone in facing this. Many of the shelters were never able to get anywhere near their capacity because of the social distancing that the protection against the disease required. The public health department is still providing overflow space. And I'm glad to report that the city has now established a large non-congregate sheltering program at several local hotels here in the city of Indianapolis.
Oh, that's great. And that's that's a model that that we want to dive into a little bit more. So can you talk about what you're learning about these hotels that are serving as non-congregate shelter? How have you funded that effort? And what about that do you hope to continue once the pandemic is over?
Yeah, those are all good questions. We began by self-funding um, the response and the relief effort in March. Fortunately for our city, as is the case for the country as a whole, um, since the passage of the CARES Act in March, we've used coronavirus relief funds and emergency solution grants in addition to FEMA reimbursements for what became our early response. So self-funding, CARES Act, coronavirus relief monies, um, emergency solution grants, and then FEMA reimbursement. We plan to expand our non-congregate shelter approach and keep it in place through next spring. And at that point, we'll reevaluate our situation based on the public health environment. We're expanding our non-congregate shelter availability just this past week. The Indianapolis Mayor City County Council appropriated the remaining coronavirus relief funds that the CARES Act had directly provided the city of Indianapolis. You know, we're coming up against the December 30, 2020 deadline, so that if your relief funds are not appropriated and expended by then, you have to send all that money back to Washington. So I must say, I have to applaud the City County Council here because they have now formally appropriated, and we are in the process of committing the entire relief fund we received. And it was $168 million, which certainly helped Indianapolis out in a wide variety of different ways.
So we know that the priority in the early days of the pandemic was the public health response, and we know that housing is healthcare. Can you tell us a bit about what you focused on after your initial action on hygiene and implementing the non-congregate shelter?
Yeah, Peggy, there have been many creative temporary solutions that the city of Indianapolis has brought to bear in response to COVID-19, most of which are aimed to help get our most vulnerable people off the streets. So now we frankly need to pivot from a crisis response to finding permanent solutions. That means helping people get out of shelters and into housing. And that is why the $10 million in CARES Act emergency solutions grants are so important. Nearly 90% of those funds will be used for rapid rehousing, both of sheltered and unsheltered residents.
Right. And how does your commitment to housing first inform your response to the COVID crisis?
Well, it would be easy to resort to purely short-term responses and quick fixes, no matter how attractive they are from time to time. It's not sustainable, and it's not answering the more fundamental question, and that is, how do we provide permanent supported housing for the people of the city of Indianapolis? The fact of the matter is, a housing first approach doesn't have to take a back seat during a public health crisis. Housing is a public health response. I've directed my staff and I've urged my community partners to find ways that we can use the resources, these and hopefully more resources that may be coming sooner rather than later from Washington, to strengthen our community plan to end homelessness in the long term.
So along those lines, although Governor Holcomb's eviction moratorium recently expired, the federal government has instituted a new ban on evictions that's effective through December 31st. And it's targeted broadly to people based on their income and their risk of homelessness. Do you think this temporary halt on evictions will curb entry into homelessness? And what concerns do you have about what will happen to people once this federal moratorium ends?
Yeah. Well, those are very good questions. Look, I would be remiss if I did not compliment the governor for the eviction moratorium that he implemented, and obviously, most recently, the federal government's ban on evictions through the end of this year are important. Back in April, we began planning for what we knew would be an unprecedented need for rental assistance at some point. Back in April, we were thinking, obviously, that point would come at the end of the governor's moratorium. Now that's been extended, but we are fortunate that we began our planning in April. In July, we launched our rental assistance program to the tune of about $20 million in direct aid to those renters who had fallen behind because of lost jobs and other challenges that were COVID related. And frankly, even at that time, July, it was one of the largest programs for a city that is the size of the city of Indianapolis. We also knew that even a $20 million amount was not going to be enough. We realized that going in. In fact, Peggy, in just 3 days after we announced the program, we received over 10,000 applications in 3 days, with a waiting list that has now grown to over 25,000 individuals or families who are seeking rental assistance. We've since added another $15 million more to the program, while also collaborating with legal resources to ensure that any resident of our city who faces eviction has access to free legal representation and counsel. But I remain deeply committed to avoiding evictions whenever and however we can. The recent CDC eviction moratorium does help in the short term, but I'm wary of your question, and that is what happens on December 31. Come January, when it expires and residents are facing large amounts of back rent. So local governments across the country face a scenario where our sources of federal assistance are nearly depleted. Meanwhile, tenants and landlords still have massive bills, and those will only continue to grow as industries continue to be impacted by the pandemic. So local governments who aren't particularly well equipped to deal with the depth and the length of a crisis of this magnitude just simply need continued federal assistance. And we are advocating more federal assistance with our representatives in both the Senate and the House of Representatives in Washington all the time. And we are cautiously optimistic that sooner or later, hopefully sooner rather than later, Congress will be able to come to some kind of compromise that will provide added assistance to local and state governments on these issues.
Yes, I agree on the hopefully sooner point on that. So what's the most important lesson you've learned through this process?
I think the most important lesson, Peggy, is that collaboration or a collaborative response is critical, and frequent communication is key. We have a robust community plan to end homelessness that we launched in 2019. I think there was concern that we might abandon that plan as the pandemic first reared its head and then expanded exponentially. But we still have regular check-in meetings with our shelter operators, as well as with our local continuum of care organizations. The advice of local COC has certainly informed the housing investments that the city of Indianapolis has made. And the technical assistance received from HUD is helping us build a stronger infrastructure that I am convinced will last far beyond the pandemic. You know, we have a long road ahead of us, but we'll get to the other side. And when we do get to the other side, I hope it's a side that provides permanent supportive housing for literally as many people in the city of Indianapolis that we can possibly dream of.
Great, thanks. Thank you so much for your leadership on these issues and for your willingness to share your thoughts and the great pieces of implementation work that's gone on in Indianapolis. Thank you so much. And as we close out our conversation, I want to remind everyone that we have created the At a Glance matrix to help local policymakers navigate more easily by prioritizing among the potential uses of CARES Act funding. You can find it and other tools at housingequityframework.org. Our global recommendation that is important to keep in mind in all of this work is that across all of the potential interventions, communities should be prioritizing people with the highest needs, like people experiencing homelessness first. This will ensure that those who face the greatest hardships will receive the help that they need. Thank you, Mayor.
Thank you, Peggy.